Hello. There was a question about rapamycin, so I'm going to try to answer that. Um, so, rapamycin is a very interesting molecule. So, it was developed in Rapa Nui, otherwise known as Easter Island. It was found in soil. It was a bacteria. It was found in a bacteria, but just like penicillin in a way. So, but it's not an antibiotic by itself. I think in the beginning they were thinking that it might be an antifungal, but it turned out that rapamycin is an immunosuppressant. So they use that for organ transplant, especially for kidney. And rapamycin is now being studied for very different reasons. It's able to slow aging and regulate metabolism. It works by inhibiting a pathway in the body known as mTOR. And we also use this for treating cancer. So um, but it's different than LDN. LDN is very gentle. I can use high doses. I don't have to worry about it. Rapamycin is not like that. You do have to worry or be aware that its original function we use in medical purposes is immunosuppression of organ transplant rejection prevention. So you have to be very, very careful. So the mTOR is basically a master switch that controls cell growth, inflammation, nutrient sensing. So when it's overactive, that's when you have a problem, disease for aging, diabetes, cancer, even Alzheimer's. So mTOR modulation, I think, is crucial, and it's very different than how LDN works. So in functional medicine, we're always asking, what's the root cause? How can we optimize the body system naturally? Rapamycin is a natural product. Of course, it's a medication now, and I prescribe it through compounding pharmacy. But rapamycin um, is able to, of course, reduce chronic inflammation and bring and it's thought that it can mimic the effect of fasting, improve on autophagy, which is cellular cleanup or recycling system. So in functional medicine, we're looking at low dose intermittent use of rapamycin as a way to gently dial down mTOR without the immunosuppression. So combination of LDN is fantastic because you're working on the immune system, making sure that it's not going to be dialed down too much, but you can dial down a little bit. So I have patients with autoimmune conditions that I do use LDN, high doses, rapamycin, low doses, pulsing, and we get fantastic results. And um, I really, really think that it's really amazing tool, but it comes with risks. You can get mouth sores, you can have altered lipids, you can have insulin resistance if not used properly. So, the best way to do the natural mTOR modulation is intermittent fasting or prolonged fasting or low carb diets or ketosis. And in my book that I just published on LDN therapy, we talk about all that and more. And thank you for joining me and listening to me. Thank you.